I'm Dr. Bob Gill. I'm joined by Dr. Paul Hobday, a retired NHS GP, and I'm also an NHS GP. Now, we're here today to try and alert you to what's happening to general practice, which is quietly being forced through under the cover of Brexit and other distractions in the news. But what is actually happening is very important and will fundamentally break up general practice as we know it. So, Paul, can you just outline the main factors that are at play here?
Yes, this is quite worrying and it's very complicated, unfortunately. GPs in general are going to be pretty well forced into primary care networks. This has all got to happen very swiftly by the 1st of July. Now, primary care networks are a new phenomenon. They're the building blocks of integrated care systems, which, as many people might know, are will be imported rather from the US. It's a US-style health care, the successors to HMOs and accountable care organisations. And the government's plan is to have these in place in every part of England by 2021, which is obviously only 2 years away. That bit's fairly transparent. The complicated bit and the bit that might blind people is in the detail, of course. GPs are being seduced really by the promise of money and the promise of more staff, which of course nobody can argue with that. That's exactly what they've been calling out for many years, since the starvation of general practice that began in 2010. But there's a lot of hidden strings to this. For instance, the staff. A lot of extra staff will be brought in, and these people of various different grades and skills will be asked to do the work of doctors.
So these will not be doctors, will they? There won't be GPs. There'll be substitutes for GPs.
Absolutely. They're non-medics, and they're a way of getting work done, but of course at increased risk to everybody, themselves and patients.
So you're going to have a diluting down of experience and qualifications, and with that comes more risk for the patient. But also what people need to grasp, I think, is that relationship between the patient and the doctor will be absolutely broken apart. Why is that relationship important?
Oh, this is crucial. It's fundamental to good patient care. It's been one of the cornerstones of the NHS since 1948. The continuity of care, you knowing your doctor, you knowing your GP, and good traditional family general practice. Well, this is under so much threat. I would say it's coming to an end. And you'll not only lose your link with your doctor, you'll lose your link with the practice, because local practices will disappear. They're all being bunched up into hubs, so that there'll be large centres quite a long way away from your home probably, which may be all right for the young male who might have a knee ache, but is not good for the elderly and that sort of care. And continuity of care is not only appreciated, it's efficient, it's less risky, and if that is broken, which seems to be a deliberate policy, then there's a great deal to fear.
Now, we know with successive NHS reform, what is told to the public and sold to the profession doesn't really match the reality. And what you've outlined is the combination of the downskilling, the breaking of the doctor-patient relationship, but crucially, the configuration of these networks, which are based on the American-style HMOs, will in due course be handed over to the private sector.
Yes, this is basically the integrated care systems. They're sort of commercial ventures, really, or can be. Initially, they're not going to be portrayed that way, of course, because that would be impossible to sell to the public. But they're going to be a stepping stone to the commercial field, where big healthcare providers such as United Health and Virgin can basically run them, as can insurance companies, and believe it or not, other big multinationals, whether they're property developers, banks, etc. And these people will be able to share their profits with the commissioners.
So we've already seen some of this happening, and there are certain details that are out there in the public. The number of practices will be shrunk from what was over 8,000 in 2010 down to 1,500 across the country. Already some of this network principles have been put into practice down in Cornwall, and patients are already having a very hard time accessing a doctor. So your right to see a doctor is being removed. Very similar to what's happened in out-of-hours care. We've had a gradual dilution of it being run by doctors, then by nurses on a helpline, and now you've got 111 being run by school leavers looking at a computer screen. This will be replicated within the rest of general practice. So at the moment, GPs are being persuaded with the offer of extra cash, but they don't quite understand what they're going to be signing up to.
That's true.
What do GPs need to hear to really understand the threat that they are potentially facing here?
Well, the first thing is that this money is not going to be there to help you with your current workload problems. You're going to need to do other things for this extra money. And it's quite unlikely you'll see the extra money if you're a GP. It will be siphoned off for paying these new levels of staff and for other things, for pharmacists, physios, who may be the first point of call of a lot of patients.
So you're going to have patients being unable to book to see a doctor. They will have to go through several hurdles before even getting access to the doctor. And as you say, you will have other health professionals doing the work that doctors used to do. So this has major implications on patient safety. But also there are strings attached to the network funding. And what GPs need to understand is they are actually giving away autonomy, and they're giving away control of their patients. Ultimately, the networks will have more and more and dictate exactly how the GP will practice, and also hold them up to certain targets. And in due course, they will be incentivized to deny care, because that's how the American model works.
Yes, the days of a patient being able to say, well, my doctor's Dr. So-and-so down the road, they're frankly at an end, or they will be once his system takes over, which is going to be steamrolled through very swiftly. And I can't emphasize enough how terrible that will be. People will be giving up on the service because, as you alluded to, when you ring your surgery, which would probably be some sort of 0800 number now, you'll be put through to a school leaver first, and then maybe a receptionist, perhaps a nurse if you're lucky. Eventually you might get through to see a doctor, but all the policy is really to separate doctors and patients and keep you away from doctors, because doctors actually use hospitals, and this is not part of the plan.
And you mentioned hospitals. A key element of the government's trashing of the NHS is to shut down more hospital departments, to in fact cut 30 million outpatient appointments. Now all this work is supposedly going to be done in the community and in general practice. But what you will have is health professionals all acting outside of their competence. And this is an inherently unsafe and dangerous arrangement that we're being forced towards. How might you sum up the warning you would give to patients and doctors about becoming parts of these networks?
Well, summing up as far as patients are concerned is that you have to really start thinking about this and fighting it, because you will not have a GP anymore, you will not have a local surgery once these all come through. Furthermore, if the integrated care systems take over, we will be having imposed on us undemocratically a US-style type of healthcare. As far as doctors are concerned, they have to work within that, and that will get rid of all the job satisfaction and autonomy. They will be controlled, they will be told how to work, they will be told which boxes to tick, they will be told who to refer to, what drugs they can prescribe, etc. There's not going to be much professional satisfaction in that.
I agree, and in particular I want to emphasize the key thing for the patient is the quality of care that you will receive will be diluted. It will be more unsafe. You will find it very difficult to access a doctor who will now no longer be your advocate, who will no longer have a relationship with you, but will be incentivized to act against your interests. Now, this is a very dangerous and development and must be fought against with all our efforts. So please share this video. Join myself and Paul Hobday and also Anna Attow, who's a retired NHS surgeon, where we'll be talking about this in a lot more detail. Please share this video and watch out for us on social media. Thank you very much.